In today's episode, we are going over a physical therapy guide to plyometrics, return to run, speed, and agility training. Let's get rolling. So, why are we talking about this? Well, first and foremost, especially for post op patients, I think physical therapists do a very good job in the early stages of rehabilitation. And we had a lot of education on how to deal with common orthopedic surgeries. So, we do a good job. On the flip side of things, we don't get a lot of education on the end stages of rehabilitation, particularly return to sport. So essentially, if you have a post op patient and you get a protocol from the surgeon, you usually have some pretty good guidance from that surgeon up until about 3 to 4 months. And then you get a lot less guidance. And it's up to the physical therapist to learn how to bridge that gap and get back to high level of a performance for that individual. And this goes for an athlete that's trying to get back to a field sport, but it also goes for the average Joe that maybe wants to get back to some sort of jogging program, or they just want to get back to being able to play pickup sports like, let's say, tennis or basketball or soccer or something along those lines, right? And generally speaking, a lot of the advancement of impact activities is not taught in most physical therapy curriculums, right? So we have a lot of questions end up being, when is it even appropriate to start plyometric training? How and when do we transition to some of the impact activity? Also, when we are allowed to start, what do we start with? And how do we progress over the course of time? What's kind of step one, step two, step three, step four, step five? If we are going too fast, how do we know, right? And lastly, I think a big problem is that most information that we have out there is expert opinion. We don't have a lot of clear-cut medical research that shows us when we're allowed to start stage one, stage two, stage three, so on and so forth. So in today's episode, we're going to go over when is it okay to start with return to run activities, plyometric activities, right? We're going to talk about progressions. We're going to talk about very easy progressions and how to progress all the way to more advanced return to sport type activities. We'll also talk about how I like to specifically progress each part of impact. So basically, we're going to go with a return to run program first. And this is my foundation for all plyometric based activities. We're going to talk about how to return back to acceleration and sprinting. We're going to talk about how to progress through plyometric and jump training. We'll chat about change of direction and agility work. And lastly, we'll talk about conditioning. So once we've built all of these elements together, right? How do we get someone more conditioned so they can return back to sport or their activities over the course of time? Welcome to the Fitness Pain Free Show. This is where we help coaches and physical therapists like you get your patients out of pain and back to training. My name is Dan Pope. I'm a physical therapist, coach, personal trainer, and meathead. I have my dream job as a physical therapist, coach, business owner, and educator. I've been doing this for several decades now. I want to help you reach your goals, and that's the whole reason why I run fitnesspainfree.com. This is part 4 on our series on plyometrics and return to running. If you missed 1, 2, and 3, I'll leave a link in the show notes. Definitely check that out before you end up watching this one. All right, let's talk a little bit about return to agility. This is going to be return to change of direction, agility, cutting, whatever you want to call it, right? It involves some acceleration followed by some deceleration, right? I'm going to refer to all this to agility as agility, all right? And first, I incorporate this after basic tolerance to plyometrics. This is not something that I introduce athletes to after they've had no experience with plyos. So first and foremost, we're building a little bit of tolerance to impact. And I'll show you where this falls in terms of a timeline, right? So when do we incorporate things like pogo jumps? When do we incorporate running? Where does agility fall in? Normally, we're doing some pogos, little return to run, and then we start the change of direction, okay? So it's also important that we build a little bit of a foundation in the frontal and transverse planes. Now, what do I mean by that? So largely we've been doing exercises in the sagittal plane. So starting off with things like squats, deadlifts, then to lunges and step ups. Once we build a foundation there, we start moving outside of the sagittal plane. We start doing things like lateral lunges, things like curtsy step ups, lateral single-legged deadlifts. So we've actually mimicked some of the forces that we're going to see in the agility program with our strength exercises. The other thing I like to do a lot of prior to beginning some change of direction work, some agility work, is incorporating more sled work. So if we think about pushing a sled forward as well as pulling the sled backwards, so a sled drag, when you're pushing the sled forward, it mimics the same position that we need to accelerate, right? and we're pulling the sled backwards, it looks an awful lot like a back pedal, right? So if we're doing some sled pushing forward and backwards, we're preparing ourselves for accelerating forward and then decelerating and moving backwards and backpedaling. Same thing goes if we pull a sled laterally. So if I pull a sled to the side, so a sled lateral step, crossover step, I'm actually practicing a lateral run at a slower speed with a little bit of load. So I really like sled variations to prepare athletes for the forces of change of direction before actually putting that impact into the program. Okay. The other principle here, and it goes for all of the rest of the plyometrics and run guidelines we talked about, essentially you want to build technique and capacity before you start to introduce power. So when I introduce change of direction drills with something like a ladder, I'm not having my athletes go full speed, okay? They're just starting to introduce those forces to the body. The technique looks really good. They're tolerating it really well. I'm monitoring them after they do the exercise at a low level, not getting painful, swollen, any of that stuff. Then we can start to increase some of the power over the course of time, okay? Easy way to do this is just to prescribe a rating of perceived exertion. So I tell my athletes, let's start at around a 5 out of 10, and then let's work our way up 7 out of 10, 9 out of 10, 10 out of 10. Okay. Very easy to advance over the course of time. All right. So now that we have the guidelines for agility, how do we actually put this together? What does it end up looking like? Okay. Let's say you have a patient post-op ACL reconstruction and things are going really well. Okay. There's no major snafus. They're going to keep athletes progressing a little bit more slowly. They're doing great. All right. So let's say around week 12, we're starting to incorporate a little bit of impact via pogos. Around week 14, we start a return to run program. I actually like to introduce sled pushing and pulling. Now, we're not doing these explosively, and that's important to understand. When I first introduce a little bit of sled work, I'm not moving really quickly, okay? It's a moderate load, and we're moving at a moderate speed, okay? If I was to give someone a sled and tell them to sprint with it, that's going to be a lot more stress on the body than I had them actually try to sprint for the first time, okay? So keep in mind, it's moderate load, moderate speed to begin. And I start with a sled push and a pull at week 12. And that's because we're introducing sagittal plane movements first. If those are being tolerated really well, we just start to work in the frontal plane. So at week 14, I start to introduce sled crossover steps as well as sled shuffling. Okay. Now make sure you subscribe to me because I'm going to be putting out a lot of videos in the upcoming weeks about what these exercises actually are. I'm going to describe them the best I can, but I understand that it's not going to make a ton of sense. But I'm going to be taping this and I'm going to be releasing them on YouTube. So definitely subscribe for that. So once we show some basic tolerance to the frontal plane, so things like lateral lunges, lateral sled drags, the next step is incorporate a little bit of impact, a little bit of speed. My first drills that I really like to introduce agility are going to be ladder drills. Now, there's a lot of hubbub in the strength conditioning world. A lot of folks feel like speed ladders are not a great way to improve speed. And I largely agree because I think they're just a low-level exercise and they're absolutely phenomenal for introducing change of direction. So what does agility mean in a given sport? Let's say you're playing soccer. Largely, it's going to be a sprint followed by a deceleration, then a change of direction really quickly. This could be a cut, or it could just be you're stopping and changing direction because the action in the field changes. All right. Now, this is going to be a lot of stress if someone's moving as fast as they can. So think if they're sprinting, they're coming up towards the top speed, then they have to decelerate quickly and change direction. A lot of stress, right? We can take those stresses down a lot by utilizing a ladder. So if I'm doing basic cutting drills through a ladder, I'm going very slowly. So the forces are a lot lower. Okay. And that's the reason why I like to use ladders to introduce change of direction. And you can introduce any direction, which is really nice. So you can go forward, backwards. You can go side to side. You can introduce some cutting. There's a lot of really cool variations. Again, make sure you subscribe to my YouTube so you can see the future videos I'm going to put out. Okay. So I introduce these ladder drills around month 4, week 16 to 17, after about 2 weeks of building tolerance here. And you'll see a trend here. I generally like to keep new exercises in for 2 weeks before I advance. I feel like this is a decent amount of time to build a little bit of capacity before progressing. The next week, week 18 to 19, I'm going to start shuttling drills. Okay. So what this means is you have 2 cones placed, let's say 5 meters apart. You run from one cone to the second cone and then back. That's what I call a shuttle. Okay. Now you can incorporate all sorts of change of direction work with a standard shuttle. Okay. So think about the same example, 2 cones, 5 meters apart. You can run to the cone, stop, and then back pedal back to the start. Okay. You can also turn sideways and shuffle from one cone to the next and then shuffle right back. You can also perform a lateral run, which is essentially you're running towards one of the cones, but you're looking in a different direction. Okay. And lastly, we can just do a run. You can run to the cone, you can turn around, you can run right back. Okay. So this basic shuttle has the opportunity for a lot of variety. It's super simple, but I think you're covering all the basic change of direction you're going to see in most sports. Okay. So guys, if you like what you're learning about so far, then I want you to go and check out the Fitness Pain-Free Mini Course. So I made a mini course. It's absolutely free. That's the next logical step if you want to learn more from me. So in the course, we go over 5 lessons. That first lesson is how traditional schooling has failed us, right? So schooling is phenomenal from a physical therapy perspective, but doesn't really teach you how to work with high-level athletes in the fitness world, right? Doesn't always teach you how to do the lifts appropriately. Doesn't teach you about progressions and regressions of common lifts within the gym. Doesn't teach you how to program normally, how to write rehab programs, or how to write injury prevention programs for these folks. Next thing we go over, 7 reasons why people get hurt in the gym, 4 simple steps to getting your clients out of pain, how to build the career of your dreams and earn the respect of your community. It's all well and good if you know exactly how to work with folks within the gym. But if you can't get these folks through the door on a regular basis, then you're simply not going to be living the dream that you want to, because you can't get the patients through the door that you want to work with. Okay. So I'll show you how to do that. And lastly, we'll talk a little bit about the Fitness Pain-Free certification, right? So I'll leave a link in the show notes. I definitely recommend checking this out. Once you sign up for the Fitness Pain-Free Mini Course, you will be automatically placed in the waitlist for the Fitness Pain-Free certification. Now, the Fitness Pain-Free certification is the course, the certification that I wish I had as a new grad that fills in all the gaps in knowledge that you don't get in physical therapy school. So A, you'll gain complete confidence working with injuries in the strength and fitness world. You'll learn optimal technique for both health and performance from myself and some of the best coaches in the world. You'll master programming for rehabilitation and injury prevention. Have fun while earning a whole bunch of physical therapy and physical therapy assistant credits. You have 31.5 of those. You'll also gain NSCA credits as well as CrossFit credits if you need those. This is the equivalent of a university education in working with injuries in the weight room. I really believe that. I've been adding to this thing over the past 5 or 6 years. It's massive, a ton of phenomenal information. And lastly, the biggest goal is just to fill your day with the patients you love working with and building the respect and admiration of the communities you love working with. So I'll leave a link in the show notes. Sign up for the Fitness Pain-Free Mini Course. The certification is open 4 times per year for 1 week to enroll into. If you're on the wait list by signing up for the Fitness Pain-Free Mini Course, I'll alert you when that next enrollment period is open and you can get started. Let's get back to the show now. Now, once athletes have shown they can tolerate these basic shuttles, okay, so not getting really painful, swollen, losing range of motion at the knee or whatever area you just had a surgery on, we can start to advance. Let's say we're now at month 5, week 20. We want to do some harder agility exercises. So what I like to do are to advance these shuttles. Okay. One of the easiest things you can do to make the shuttles harder is you can just tell your athletes to run a little harder. Okay. Let's say you start off with them running around 50% of what they feel like their max is. You can go up to 60, 70, 80, so on and so forth. Another way to make these shuttles harder is just to get a little bit more space between the cones. Now, let's say you start out with cones that are 5 meters apart. Take those cones and take them out to 10 meters. What happens is if you start running from one cone to the next, you're able to build up more speed so that when you have to slow down, it's actually harder to decelerate and change directions, okay? We're still utilizing all the same directions in the sense of forward to back pedal, shuffling, lateral run, running forward and running backwards. But now we just increase the space between shuttles so people can build up more speed. So it's harder to decelerate and change direction. Okay. It's easy to dose up over the course of time. Some of the other drills I like to utilize would be an advancing shuttle. So let's say you have 5 cones set up and they're all 5 meters apart. 3, 2, 1, go. You run from the first cone to the second cone, back to the first, and then you run all the way to the third cone and then back to the second and then to the fourth and then back to the third and then to the fifth, so on and so forth. Okay. You can also use a traditional shuttle. So again, think about the same example, 5 cone setup, 5 yards apart, run from first cone to second cone, back to the start, then to the second cone, back to the start, back to the third cone, back to the start. So you can see as we advance the amount of space between the cones, as we change the complexity, it becomes a little bit more challenging over the course of time, which is exactly what we want with our athletes rehab. Once the athletes are good at handling the shuttles, we now introduce a neurocognitive demand. Now, what the heck does that mean? Well, if you think about a sport, when you're playing a sport, you're not reacting to a cone on the ground. You're going to be reacting to people. You're going to react to a ball or a play or something where you have to think, look at the field, determine the next steps, and then change your course of action. Okay. So we want to try to mimic that as best we can with our rehab, because like I said, when people are playing sports, they're playing against people, not against cones, right? So there's a lot of ways you can do this. One of the ways I like to do this is by setting up a mirror drill. So think about having 2 athletes facing one another. The first athlete is going to shuffle side to side. Second athlete is just trying to mirror and follow them throughout. These can be done with a shuffle. They can be done with a lateral run. There's all sorts of options you can use. The reason why these are so nice is because your athlete is going to be reacting to another athlete, similar to what they're going to be seeing in a sport and not to a cone. You can also have your athletes react to you or a coach, right? So usually in a physical therapy situation, you don't have a whole bunch of different athletes in order to do mirror drills, right? Unless you, as a physical therapist, want to do the mirror drills with your athletes, which you certainly can, right? You can utilize your fingers and point from side to side to give some of that neurocognitive demand when you don't have another athlete to do a mirror drill. So imagine I'm the coach, I'm standing in front of the athlete, and I'm going to point either left or right. When I point to the right, the athlete is supposed to shuffle to the right. When I point in the opposite direction, they have to go back again. Okay. So now your athlete is reacting to the coach, pointing back and forth. Again, a little bit more similar to a game time situation. Okay. The last thing we like to introduce for a neurocognitive demand is going to be blaze pods. So blaze pods are a really cool physical therapy tool that can also be used for sports performance. I highly recommend them. I'll try to put a link in the show notes so you guys can check them out. But what they are these little pods, okay? Electronic, the Bluetooth, they hook up to your phone. And essentially you can lay them out on the ground in any manner that you'd like. And there's a lot of different games you can kind of play with these blaze pods, but largely turn it on, 3, 2, 1, go. And then one of the blaze pods will light up. The athlete runs over to that blaze pod. They tap on the blaze pod. It will turn that blaze pod off. And then another blaze pod will pop on. So they have to run over to that next blaze pod and they tap that blaze pod, turns it off. They run to the next, so on and so forth. So your athletes are getting a bit of that neurocognitive demand they're going to see in their sport. So now we're actually getting to the very end of our athletes rehab. Imagine that post-op ACL reconstruction, week 28, they're at month 7. And let's say between month 7 and month 9, our focus is really going to change towards sport specificity. Okay. What does that mean? It largely just means you want to make the rehab look very similar to what they're going to have to do with their sport. Okay. So I'm going to use an example of, let's say, a soccer player. So we start to introduce some more ball handling skills. So maybe they're doing some shuffling, and then we start to pass them a ball. So they have to stop the ball, trap it, pass it right back again, starting to work on their ball handling skills with their change of direction work, with their conditioning over the course of time. We're also going to try to start mimicking the work to rest intervals that you'll see in a given sport. We'll talk about soccer specifically in a second. You also want to mimic the sport speeds. So if you have a sport there's a lot of top end sprinting, we have to work with more top end sprinting in our agility work, right? We also want to try to mimic conditioning demands. So if athletes are going to have to work at a high heart rate for 60 total minutes, right, as part of their sport, we want to start to train that. And lastly, we're just trying to mimic the game length. So again, if it's a 60-minute game, we have to make sure they're ready to work for 60 minutes, okay? So I'll give you the example of soccer. So over the course of a soccer game at the professional level, most position players are going to be running around 6 total miles. Okay. And I think I took this from women's professional soccer, right? And essentially 25% of all of this running occurs at a sprint speed. And then 75% of the rest of the running is at a walk, a stand, or a jog. All right. So about a quarter of the time, athletes are sprinting. And then 3/4 of the time, they're walking or jogging slowly, right? And the average sprint is around 15 meters at a time. Athletes have a varied recovery time, but it really is like that, 1 to 4 work to rest ratio. And this is obviously going to vary based on the position. Obviously, a soccer goalie is not going to need as much conditioning, right? So this is a workout that I set up for a prior athlete of mine. And essentially, what I've tried to do is mimic the sport demands as much as I can. So you notice all of these are done with a neurocognitive demand, and we use blaze pods for all of these drills. We also utilize a lot of ball handling drills. So largely, we were having our athlete react to the blaze pod and then react to a ball, trap the ball, pass it back again, react to a blaze pod, right? And our drills all incorporated work to rest ratios. And then essentially would have an athlete work hard for, let's say, 20 seconds, right? And then they would do some sort of either walking or jogging for 40 seconds or so. And we varied the time domain that they were working. So we know the average sprint is going to be around 15 meters. So we tried to mimic this as best we can with our drills, right? So our first drill of the day, we did 20 seconds of work on, 40 seconds of walking. And that was a lateral sprint with blaze pod taps. Did a few sets of that. And our second exercise was 60 seconds on, 30 seconds walk. We utilize a ball circle drill where we react to ball drops and sprint back after you're finished up. Third exercise was 45 seconds on, 45 seconds off. We did some reactive passing, running back and forth between, blaze pods, and then trapping a ball and kicking it back to the physical therapist. And our last exercise was, again, a time domain of 60 seconds on, 60 seconds off. And we did a circle drill with a reactive passing similarly, right? And what we did was we started with a low amount of sets. So week 1 and 2, we did 4 sets. And week 3 and 4, we bumped up to 5 sets. We also had our athlete wear a watch that was measuring how far she was running the entire time. And we had her perform drills similar to this for around, I would say around 8 weeks. And what we started with around, I want to say 3.5 total miles covered during these drills. And then we finished off around 5.5. So as our athlete got better condition, they just started covering a little bit more ground. And we also increased the sets over the course of time. So again, we're trying to get close to that 6 miles total that you'll see at the top level for a professional athlete, right? And I got to tell you, these drills are extraordinary for improving patient confidence, right? I know a big issue that we have post-op ACL in particular, athletes don't feel ready to go back to their sport. That makes total sense. As physical therapists, we're terrible at introducing plyometrics in general, let alone working towards higher level change of direction drills, agility drills. If you have your athlete performing drills like this and they're working at a high level and their conditioning is very good, their ball handling skills are coming back, they're reacting to game time situations, then they're probably going to feel much more confident than if you don't do any of that. Okay. So in terms of psychological readiness, these return to agility drills that are very sport specific are game changers. If you guys enjoyed this lesson and want to learn some more, I have another video for you. It is going to be an evidence-based guide to the treatment of patellofemoral pain. So if you're working with athletes that are having a little trouble running, this is a video for you. Check it out. If you guys want to check out the references, I do recommend reading through some of these articles. They were very helpful for me as a clinician. I'll leave a link to all of these in the show notes, and you can check them out. And lastly, thank you so much for your support. You truly allow me to do what I love for a living. If you're watching this on YouTube, please hit that like button, comment, and subscribe to the channel. It helps me out tremendously. If you are listening or watching the podcast version of this, please leave me a positive rating and review. Again, helps me out tremendously. If you want to go that extra step and support me further, consider subscribing to Fitness Pain-Free Insiders. It's a comprehensive educational resource and toolkit for the fitness and rehab professional. Think Netflix, but for trainers and physical therapists. You have premium content from me, very similar to what you're watching right now, but more in depth. You get updated monthly webinars delivered via me. You have over 100 webinars, ebooks, and complete guides at your disposal. You have access to a private Facebook group to have all your questions answered by me. You can decide upcoming podcast topics. And the best part is you can get started for just $1, right? And lastly, you can cancel anytime. If you do cancel, I'll be a little sad, but that's okay. I'll leave a link in the show notes, but if you want to get started right now, head to fitnesspainfree.com, click on the programs link, and then click on Fitness Pain Free Insiders online library to get started.